Hi there, there's Dr. Jason Tripp. I'm a chiropractor and a naturopath right here in Hermitage, Pennsylvania. And today we're going to talk about neck pain. If you've been struggling with neck pain, there's a chance that you may not have to. There are a lot of techniques that are out there that will actually help with the pain. Now, the first thing I want to tell you is if you're struggling, it can be a muscle, it can be a nerve, it can be blood flow. Like there's different things that can cause that. Most of the time, you're going to have a nerve issue. So let's rule out muscle issues. If you've had it only a couple days and it goes away, it's probably a muscle issue. Not a big deal. But if you've had it and it's longer than just a few days, more than likely it's a nerve. Any buzzing, burning, tingling, if you have any sensations radiating down the arm into the hand, then more than likely it's a nerve. So when you're looking at how to deal with a nerve problem in the neck, we start to think, okay, how is your alignment, number one? Is the spine lined up? Or is it out of line? In other words, is your neck crooked or is it straight? And so you can only see that on an x-ray. There's certain tests you can do to find out how you're functioning, muscle testing, range of motion, those kind of things. But the alignment is really the biggest issue. And is it out of line crooked, stretching tissues, causing the tissues, when they're stretched like that, they cause pain. And so if you're having a pain in the neck, it could be from muscle, remember, just a couple days, or it can be from nerve, which is a pinching of something in your spine from an alignment issue where it's twisted and it's out of alignment. Or it actually could be from a disc. So the longer a bone is out of line, that pressure on a spine going crooked like this can actually squeeze the disc out. If you're squeezing the disc out in the neck, that can cause you to have a bulge in there, and that can pinch the nerve, which can cause pain. Now, normally you'll get that radiating down the arm or into the hand or even cause carpal tunnel. There's different things that it can cause when it's pinching right there in the neck from a bulging disc. So if you're having some disc issues, or if you're having pinched nerve, or if it's just a muscle, remember, you don't want to wait on it. It's progressive, and the longer it's in there, it gets worse and worse. So we don't want to see you have a problem that can go to permanency. What will happen is somebody will have a pain or a problem, and they'll go, no big deal, it'll go away. And it doesn't go away. And they go, no big deal, I can deal with it, or I can handle it, or I push through. It's almost like we feel like we're tough if we can push through the pain. But the reality is pushing through means you're not getting better. Not getting better means that it could go into permanency. You have a certain period of time that your body's going to go through each phase of healing. So there's the relief phase to get out of pain. There's the repair phase that your body's healing and putting in collagen. And then there's the remodel phase, and that's when it's like wet cement. When it's wet, you can work it, mold it, shape it, move it, correct the spine. When it's dried concrete, you can't move it, you can't change it. So if you go through all the phases of healing and you still have increased nerve sensitivity, or you still have nerve entrapment, or you still have that pinching going on, then it could literally stay that way the rest of your life, off and on, periodically for the rest of your life, where you would have a pain, or maybe you just turn your head wrong and it would start this pain again. And so we don't want you to go into a state of permanency. Most of the cases are not to that stage, but there are tests to find out. So we do the test. If you're beyond 85% damage, you're probably already into that stage. You have put this off too long. But if you're less than 85% damage, there's a really good chance that we're going to be able to help you without the need for drugs or surgery. So the best thing I would recommend would be to find out what you can do, what can be done. Get the test done to find out, do you have 85% or more damage? And then if it looks like there's less, what do? Well, you want to get the exam, consultation, and even get an x-ray to see the alignment. You want to find out if it's crooked in there, or if your head's forward, or those kind of things causing this pain. If it is, that's a fairly easy fix. It just takes time. However, if it's a bulging disc, that's a whole nother issue we'll get into on another video, where you can use spinal decompression to decompress the disc and relieve the nerve, so you can actually get that better too. Now listen, if you have neck pain, I want you to communicate with me. Let me know what's going on. Put a like in the comments below, and let me know that you're having a pain, or put yes. Put a yes in there, I have pain. Or if you have a question, ask a question. I want to hear from you. I'm looking forward to helping you. If you want to get some information about neck pain, or if you want to ask questions, or even come down and talk to me, then call the office and I'll be glad to help you.